Budget cuts will severely limit services at what used to be around-the-clock shelter for the homeless and mentally ill. Fox 2's Amy Lang live tonight in Detroit with a look at what will happen to the people who rely on that program. Amy?
Well, it's already happening. These folks will still get services like mental health and health care and substance abuse treatment, but usually they can rely on the Tumani Center for shelter 24 hours a day. Now you can see the line behind me, people waiting to get in after being stuck outside all day.
I had no choice. Get out of here at 6 o'clock. That's it.
Alan McClary and more than 100 others had to leave the Tumani Center early Thursday morning. Budget cuts cutting services for Michigan's homeless throughout the state. With nowhere to go, he went back to bed, but obviously not in a bed.
Oh, I went to sleep. I sleep on the ground.
It's a deep and potentially devastating blow to programs helping the homeless with mental health, substance abuse programs, and health care. The Neighborhood Service Organization will still provide those services, but can no longer provide shelter 24 hours a day. Instead, new signs are going up. Shelter only at night.
We're really concerned whether people are going to follow up with the mental health appointments, the substance abuse appointments that we still will be offering during the day.
Sheilah Clay is the CEO of NSO. She's already had to lay off staff, all because the Medicaid expansion that should have happened in January didn't happen until April because of the state's lawmakers, who also cut general fund dollars that were paying for the uninsured. Healthy Michigan money will eventually help cover people, but won't cover everyone.
We have a mobile crisis response team that picks people up on the street. They terminated all funding of that program as of last night.
Clay says NSO is so concerned about so many homeless on the street, the organization is still going to fund one team for the Road Home program.
We're really afraid if nobody's out here trying to pick them up on the street, the people will call the police. You'll criminalize homelessness. They'll end up in the jail, and the only crime is that they were homeless.
Estimates have put Detroit's homeless at close to 20,000, but that number fluctuates. It would be nice if this center was empty because all of the homeless had housing. Instead, they don't even have this shelter. Have you ever seen these chairs empty?
Never, ever. The effects of the cuts are just devastating.
Tumani operations manager Lewis Hickson has been here for 10 years. Normally, he would have 50 women and up to 80 men here getting food and shelter. Now, at least during the day, they're on the streets.
It's a sad story for some of the most disenfranchised people we have in our community right now.
Now, we did reach out to Governor Snyder. A spokesperson tells us that the enrollment in Healthy Michigan is robust and that there is more funding in Healthy Michigan for mental health. The problem, the folks here say, is that that doesn't cover everything. And so many people are so mentally ill, they're not even going to enroll in Healthy Michigan. They say what needs to happen is lawmakers need to release some more general fund dollars that they have that these folks need. For now, live downtown, I'm Amy Lang, Fox 2 News.